Day guys, this is day 9 of the oral surgery rotation. As you can see, guess what these are? These are teeth. 8 of them actually, which were extracted by myself. We had two patients today. Both of them were developmentally challenged, so they had to be placed under general anesthesia. Of note, you must remember that we still use local anesthetic for hemostasis during these procedures, even though they're under general anesthesia. These patients had developmental delay and cerebral palsy, so they were unable to tolerate the procedure under LA. So it was quite interesting. First patient had a supernumerary premolar, which is palliatively displaced. Removed that, and then the consultant did a third molar extraction, which had pericarditis. And then the next patient had severe periodontal disease, so numerous teeth. I removed like 7 from the second patient and 1 from the first patient. You can check out this jar here that will show the teeth, because I have them preserved, because I want to use them when I do get to go back to school for my endodontist rotation, where we have labs that we use the teeth to practice root canals on. So yeah, it was an interesting day. We had a third case actually after these 2 patients, which was an orbital fracture once again. But I couldn't stay because I had to rush to come to this office. But it seems as though I made a bad decision and left, because literally I've been here from about 4 o'clock and it's now 6. It's now 6 and some change, 6:15, and I haven't seen a single patient. So I was actually feeling a bit bummed just now. So I said, let me just vlog to make sure that I get my shot in a medical background, as opposed to doing it when I'm home. So I've been doing a lot of research from the Canadian point of view for training in oral and maxillofacial surgery. So there will be an upcoming video on that. But for now, I'm just going to update you on a few little things that I picked up today. For one, I thought that once you place the patient under general anesthesia, that they would just do the extraction and just finish with the patient. But the consultant infiltrated not only with local anesthetic, which would be lidocaine with adrenaline. He also used marcaine as well to give the patient anesthesia for a prolonged period after they woke up, and then that was topped up with pethidine given by the anesthetist. So that was pretty interesting, because marcaine has a long duration of action, and the patient, when they woke up, would have then been a little bit more comfortable for a longer period of time than if we just did lidocaine without adrenaline and did not use marcaine. So that was pretty cool. And then the second patient, another thing we have to take into account, the patient had a premorbid history of particular disease that warranted us erring on the side of caution when it came to the amount of adrenaline used. So that was another thing too that was quite interesting. So everything that we learned in surgical principles was coming back to us. So hemostasis, to achieve hemostasis was also a big thing, because as you know, if you remove multiple teeth, you have multiple sockets, and multiple sockets can bleed. So hemostasis was achieved via pressure to the area, as well as suturing. But if that didn't work, we probably just use Surgicel, or Surgicel is the most commonly used. But I was looking at a report recently that was a research paper that showed that Surgicel actually increased the likelihood of dry socket. So when you use one thing to prevent another thing, you ended up with another complication. So yeah, it was a pretty interesting day. Believe it or not, this is actually the first time I've done an extraction, and I was blessed from the point of view that I got to do 8. And yeah, so I have them here. I'll show you. I'll put them in the picture. I'll show you there. And I've preserved them in water and Clorox, or as we would say, bleach, to just make sure that they're relatively clean. So when I leave here, I'll be going home and pretty much just relax a bit. I don't have much studying to do, because as you know, I won't be continuing school next semester unless a miracle happens. And yeah, so yeah, hope you enjoyed this video. I'll try to do a little bit more.